Hello, everybody. This is Dr. Modupe from Tokita Diary. I welcome every one of us to tonight's episode. We'll be talking about sexual health problems in women, and our focus is going to be on sex after menopause. For those of you that have never watched our videos before, you can follow us on Facebook and Instagram, and you can also click the subscribe button on YouTube. So, back to our topic: sexual health problems in women, sex after menopause. What is health itself? The World Health Organization, WHO, has defined health as a state of physical, mental, and social well-being, and not just the mere absence of sicknesses or diseases. So if we put that together, sexual health problems, which means any problem arising from our sexual life affecting our health, that is a sexual health problem. Now, statistics have shown that 1 in 3 women in their young age or middle age will experience some forms of sexual health problems, while 1 in 2 older women will have some sexual health problems. What are the things that causes sexual health problems? So many things can cause a woman not to enjoy sex. It could be physical reasons, for instance, problems in the vagina, or maybe disease conditions in the body, certain medication. Imagine somebody who's having pain from having sex, maybe as a result of the irritation of the vagina or maybe an infection. She's not going to enjoy sex. That problem needs to be treated for her to enjoy sex. And sometimes sexual health problems in women can arise as a result of psychological reasons. For example, a woman who's having problems in her marriage or problems with her spouse or partners, she won't be in the right psychological frame of mind to enjoy sex. Or maybe she's going through some forms of stress, she's depressed, things are just not happening right in her life. Then the last thing on my mind will be sex, in which case she's just not going to enjoy it, because your mind is very important when in us enjoying sex as well. And the third cause is a combination of both physical and psychological reasons. Sometimes one starts and the other comes in, and then it becomes like a vicious cycle. So some physical causes can lead to psychological reasons, and as such, a woman can have a combination of both affecting her sexual health. So now, what is menopause? Menopause has been defined as cessation of menstruation. On the average, women attain menopause between the ages of 45 to 55. But sometimes 1 in 100 women experience menopause before they are 40 years of age. This is termed early menopause or premature menopause. A woman that's has a menopause before the age of 40 actually needs to see a doctor to be investigated for possible reversible causes. And in a case where this cannot be reversed, such women usually are advised to go on what we call an hormonal replacement therapy. Basically, these are artificial hormones given to replace what that woman would have had if she was still having her period. And then she can stop it when she's about the age she should have attained menopause, which is about the age of 50. Now, for women who are menopausal, a lot of women before they even attain menopause start having symptoms of menopause. This can happen a year, 2 years, 3 years, 4 years. It just varies in women even before menopause. Part of the symptoms they experience is irregularities in their period until the period finally ceases. Then some symptoms of menopause include hot flushes, where the women feel very hot, especially at night. Some women feel very irritable. They get angry very easily, whether with their partners, their children. They just don't understand what is happening to their body. Some women will feel very tired. And sometimes some women have symptoms in the vaginal area. They start feeling very dry there. The normal natural fluid that keeps it lubricated to help them enjoy sex is no longer there. As such, the vagina gets very irritated easily. They can have things like dermatitis, that means irritation and itch, and when they have sex they can easily feel pain because the area is so dry and becomes very irritable. And all of these factors affect a lot of women once they are in menopause. They just seem to lose their interest for sex as a result of the physical changes that is happening in the body. Usually, a woman who is not menopausal has a combination of hormones working in her body to keep all of these things going well, to maintain their psychological well-being and their physical well-being. A very important one is the estrogen hormone. When a woman is about attaining menopause, the estrogen hormone begins to drop gradually until by the time their menopausal is practically insignificant in the body. And estrogen has been found to be very useful in the body of a woman. It helps to keep a lot of things going, a lot of organs to function well. It has an effect on our heart, it has an effect on our bladder, it has an effect on our mood, it has an effect on our vagina. That's why a lot of women, when they attain menopause, some of them have local symptoms like, oh, my vagina is so dry, I get irritated easily there. Sometimes some women will say, my bladder, I don't understand. It's as if sometimes when I cough or sneeze, I'm having leaks of urine, which I didn't used to have before. These are some of the things that can occur as a result of very low estrogen due to menopause in the body. Now, I've seen women come to me crying that, doctor, my marriage is breaking, help me. I'm not enjoying sex again. I'm even not just in the mood to have sex. Then besides that, I'm having pains. I'm having discomfort from sex. I just want to be left alone. And I've seen men. A man once asked me, doctor, my wife is menopausal now. Can she still have sex? Is it safe for me to have sex? I want to tell us today, menopause is not a contraindication to sex, okay? The fact that a woman has become menopausal does not mean she can't have sex or she can't enjoy sex. Now, some of the challenges from having menopause, your doctor can easily manage this for you. Sometimes some women just want their mood to go back to normal, in which case all those kind of women need is a mood stabilizer, maybe some kind of antidepressant or something. Some women just don't like the overall effect of the menopause and they are so desperate to have something done. In those kind of women, there's what we call the hormonal replacement therapy. But your doctor is going to ask you some questions about your family history, for instance, any history of breast cancers, malignancies, clots in the lungs or legs, and all that necessary history to make sure that you are a right candidate to have an hormonal replacement therapy. And sometimes some women just want that vagina well lubricated to enjoy sex with their husband or their spouse. In those kind of women, there are actually local agents that we can give to them, like the estrogen gel. Once it is applied in the vagina, it keeps it moist, give it the same feeling like the vagina would have felt before the woman attained menopause. In which case, when she's having sex, she's not feeling dry, she's not feeling uncomfortable, and she can actually enjoy sex. So my message today is for all women out there, whether you are perimenopausal or you are menopausal and you are thinking because you are at that age, you don't have a right to enjoy sex anymore. No, you are wrong. Or whether you are thinking, oh, all these symptoms, I'm old, of what use, and then it's affecting your marriage, it's affecting your relationship. I just want to tell you today, menopause is a natural phenomenon. Every woman will go through it. What age we all go through it, we don't know. But the thing is, there's always help available. If you talk to your doctor about it, there are things that can be done to make sure that you enjoy sex even after you are menopausal. And for men that keep asking out there that, oh, because she's menopausal, I'm not going near her, let me go and get a new chick. No, that's not right as well. Okay, your wife being menopausal, your woman being menopausal should not be the end of sex, should not be the end of quality and good sex in your relationship. If there's any issues, please feel free to speak to your doctor about it. You can go through together and decide on the best management and treatment approach. All right, ladies and gentlemen, I hope we have all enjoyed that and we have all been able to pick one or two things from that message. Until we see again, I am Dr. Modukwe from Dokita Diary. Please don't forget to follow us on Instagram and Facebook, and on YouTube. Don't forget to subscribe to our channel. Bye.